The South African Medical Association is calling for the exemption of hospitals from rolling blackouts. It says it is putting the lives of patients, especially those in ICU, at very high risk. For more on this, I'm joined by a psalmist, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, good morning to you, and let's not beat around the bush. Patients could lose their lives because of load shedding. Is that a fair statement?
Good morning to you, Gareth, and good morning to your viewers. It is, yes, indeed, a fair statement. There is a huge possibility that patients are going to lose their lives, those that are at risk, those that are going to ICU, those that are going to theater, maternity cases, cesarean sections, emergency cesarean sections, and also those babies who are kept in incubators. Those who are worried about. Those are the most vulnerable in the healthcare system. So that is why we're calling upon upon government to make sure that those hospitals are spared, all of them, in fact.
I see reports as well. The Department of Health, Doctor, is saying that there are efforts underway to make hospitals exempt from blackouts, from load shedding, from power cuts, whatever you want to call them. The point is the power is going out. What do you know about these engagements? Have you heard from the department yourself?
No, not as yet, Gareth, but I think it's a good thing that those negotiations have started, because I don't think we can wait any longer. We already know that it has affected hospitals. I know one in the Eastern Cape, for example, where an orthopedic hospital has to postpone its theater cases simply because there is no water, and that water apparently is linked to the power generation or power supply. So it is important, honestly, that we do it as quickly as we can.
If you were to give me the names of 3 hospitals, Doctor, if it's at all possible, or even one, if it's possible, what hospital at the moment is in dire straits as a result of the load shedding? Because you made a very good point now. Water and the availability of water is linked to electricity as well. Is there one hospital that comes to mind that is of grave concern?
Well, so far we're told about Bedford Hospital in the Eastern Cape that has been affected. So I'm sure that there are many other hospitals. You'll recall that in most cases when colleagues are reporting to us as the South African Medical Association, they most of the time want to be anonymous. But obviously they would give us names of the hospitals. But so far Bedford has come forth as one of the hospitals that has been affected.
What kind of backlogs are we looking at already so far, Doctor, as far as surgeries? You say it's having a massive knock-on effect for neonatal and ICU. What about surgeries in our country? What's the knock-on effect there?
You will recall, Gareth, that we have had a pandemic that has affected how the hospitals are working. That involves, postponing surgeries in the hospitals, and that has created a lot of backlog in the healthcare institutions. So if you add now these power cuts, that already the system is already at the back foot. So you are creating a pandemonium when it comes to cases. I mean, conditions are not waiting for power to come back. They progress. If you have cancer, that needs to be attended to. It progresses. It's not going to wait for a postponement. So it's really causing a havoc in the hospitals. But the other thing, when this power comes back, it damages the equipment that comes in. That is already there. The equipment is damaged, so you've got to go back. I mean, this is overstretches already. So if you have a system that damages the healthcare equipment, we're in trouble.
Yeah, it's the power surges, which is not just affecting residents in their own homes, but as you hear from the good doctor as well, affecting medical equipment as well. Dr. Mzukwa, when we talk about public health care, I think it's important for us to remember we're talking about a healthcare system that caters to 80% of our population. It's the majority of those of us living here in South Africa. Why aren't there backup systems like generators, like UPSs? I know they're expensive. Are they in place but they can't keep up? Or do hospitals, public hospitals, not even have any kind of backup system?
Well, there are backup systems, not in all hospitals, but the problem is that they don't kick in on time. At times, they don't kick in at all. So you've got a system that is not well maintained. It is not geared up to, accommodate these power cuts, because we're supposed to be having a system where if you have power cuts within seconds, that system should be kicking in. I understand in ICU, some of the ICUs, they've got batteries that would last for some time. But the problem is, if you've got level 5, level 6, it takes longer than you can accommodate. So it's important that we really speed up our processes when it comes to this.
Also, we're seeing reports as well, Doctor, that the amount of money being spent by Baragwanath Hospital, 3.4 million rand on diesel for emergency generators as well. So even if the generators are there, it's running into the millions just to keep these generators running. So we're talking about possibilities of generators, but you need the money for it. What are you telling the Health Minister this morning? Something has to change. What do you tell him before I say goodbye?
I am asking the Minister of Health to spare hospitals, making sure that there's power supply in the hospitals so that we avoid these unnecessary expenditures. Because that money that is taken to diesel is supposed to be money that is supposed to be doing other things in the hospitals. So in a matter of time, we're going to have shortages in the hospitals because of these power cuts.
Doctor, I appreciate your time. I can only imagine how difficult it is for you, the organisation, everyone working on the ground, all medical professionals trying to do their jobs of keeping people alive during these blackouts. Must be incredibly difficult. We are still in stage 3 blackouts at the moment. As I say, thank you to Dr. Mvuyisi Mzukwa, SA Medical Association, joining us this morning.